In the MARLIN project, we used interviews and surveys to find out more about incidence learning in Europe. We also did quite an extensive literature review. And at the core of the literature is, of course, the Basic Safety Standards Directive. And here it is mandated that incidents should be reported and analyzed, and that the findings should be disseminated to society to build a safety culture and to improve patient safety. The Basic Safety Standards was transposed into national law by all the member states. And also from competent authorities, it is mandated that healthcare should report incidents from all medical fields using ionizing radiation. The use of incident learning systems, it's pretty straightforward. We have three main components. So the first part is, of course, the reporting. The second part is performing analysis. And the third part, the incident learning system, becomes a repository of knowledge that can be used internally in healthcare, but it can also be used nationally or internationally for dissemination of knowledge. In the project, we took a look at all the countries, the member states, and we found that there's quite a variety of incident learning systems in Europe. We also found that the criteria for reporting incidents varies between countries. So here we have a little bit room for improvement. We also found a couple of other areas where things could be improved. So first off, the user friendliness of these incident learning systems. They have maybe a little way to go before they are very good to use. Secondly, all categories of staff should be able to report incidents in healthcare. And there should also be legal provision protecting reporters from repercussions when you report incidents. Thirdly, as always, education and training within this field could be improved, both for the staff to learn how to report things and what to report, how to analyze events, and how to properly disseminate. Education and training, of course, also exists when you have done a root cause analysis and you have found what was the problem or the problems that led to an incident. Education and training should also be deployed within healthcare in order to not make the same mistakes again. The implementation of an incident learning system, regardless of what level we are talking about, locally, nationally, or internationally, and promoting a wider safety culture, it requires resources. So this includes all stakeholders, so not only the different levels, but here we are talking about healthcare, we are talking about professional societies, and also competent authorities. In the project, we found that there is ample opportunity to improve the communication and the dissemination of knowledge between these layers of stakeholders, but also between countries. At the local level, we could also consider healthcare itself, and healthcare should communicate directly with patients and the public regarding incidents and the measures that are taken to prevent incidents from happening in the future. Another good example on the international level is the IAEA Saffron initiative, which is an international incidents learning system for radiation oncology. So in the MARLIN project, we found several challenges. Some of the more important ones that I want to highlight are, firstly, underreporting of events. So when events, for whatever reason, are not communicated within healthcare, and then the entire chain where positive things can happen, it breaks down. Now, there may be several reasons that we found in the project why things are not reported. This could be cultural reasons, psychological reasons, professional or even procedural reasons that stand in the way of reporting. Also, secondly, tied to underreporting is that which I mentioned previously. Perhaps it is not clear what legal provisions we have in place for protecting reporters from repercussions. And thirdly, of course, there is a certain administrative burden with reporting incidents. There is a burden with doing the analysis, and quite a lot of work needs to be done with root cause analysis and follow-up, retraining of staff, etc. And we don't always everywhere have the resources and financial muscles to achieve all of these things. And lastly, I think most importantly as well, a low-hanging fruit and something that we can do with very little resources. This is the communication in society between the different stakeholders. And finally, I also want to say that the MARLIN project report will be published in the EU Radiation Protection Series later this year.